Good morning. Today's topic is neonatal resuscitation part 2. Resuscitation of the newborn baby. The first 1 minute after birth is the golden 1 minute. First 30 seconds we have to do some walk. There is a chart that after birth, if there is no meconium, dry the baby. If meconium present, suction the mouth, then the nose. If baby is not crying, and then dry the baby. Assess breathing. If breathing well or crying, then routine care is given. If baby is not breathing well, then initial steps should be started. At first, cut the cord, place on firm and flat surface, provide warmth, position baby with neck slightly extended, suction the mouth, then the nose, stimulate or reposition. Then assess the breathing. If breathing well, observational care should be given. If baby is not breathing well, provide bag and mask ventilation for 30 seconds. Ensure chest rise. In routine care, at first, provide warmth, suction mouth and nose if necessary, cut cord in 1 to 3 minutes, keep baby with mother, initial breastfeeding, and in observational care, at first, provide warmth, observe breathing and temperature, watch for complication, refers if so, and the complications are convulsion, coma, poor feeding, lethargy, respiratory distress, etc. And then initial breastfeeding if well. The steps to be taken at the time of birth. Number 1. Deliver the baby on mother's abdomen. A newborn baby should be delivered onto mother's abdomen. If the baby is not delivered onto his mother's abdomen, make sure there is a pre-warm towel or clothes on the bed to place the baby on. And second is call out the time of delivery. During the during calling the time, at first note the second, then minute, then hour. If meconium present, then what we can do? Meconium is the feces passed by fetus in utero. It is greenish or to brownish in color. If meconium is present and the baby is not crying, you should immediately start suction. First do suction from mouth by inserting the tube of suction device no more than 5 cm beyond the lips. Apply the suction while withdrawing the tube. Then insert the suction tube 1 to 2 cm into each nostril and apply suction while withdrawing the tube. For suctioning, attach the mucus trap to a suction machine or suck from your mouth. Stop suctioning when secretions are clear. Even if the baby does not breathe, then dry the baby as early. That Use mucus strap for suctioning. Suction mouth first, then nose. Aim before in, mouth before nose. No deep suctioning as it can cause bradycardia, that is slowing of the heart rate. Some points to be remembered: that always do suction first from mouth, then nose. Be careful not to suction vigorously or deeply. More than 5 cm in mouth and more than 2 cm in nose. It is called deeply suctioning or vigorously suctioning, as it can produce a vagal response causing the heart rate to slow down or breathing to stop. And apply suction while withdrawing the tube. Then do suction from both nostrils by placing the tube approximately 2 cm inside each nostril. Then try the baby. Keeping the baby warm at birth is a priority. The baby has to be dried with a warm towel. After drying, the wet towel or clothes should be placed and the baby loosely wrapped in clean, dry and pre-warm towel as shown in the picture. Why it is necessary to dry and remove wet cloth? After birth, the baby remains wet with amniotic fluid, which, if not dried immediately, can lead to heat loss. This heat loss may result in rapid decrease in infant's body temperature. Breathing and warmth go together, and breathing should be assessed whilst drying the baby. Drying itself often provides sufficient stimulation for breathing to start in mildly depressed newborn babies. Assess breathing of the baby. While drying, assess baby's breathing. Watch the way the baby's chest rises and falls. The chest should move equally on both sides with no difficulty, between 30 to 60 times in a minute. When a baby's breathing is assessed, one of four main behavior may be seen. These are: if baby is crying, no need for resuscitation or suctioning, provide only routine care. If baby is not crying but his chest is rising regularly between 30 to 60 times in a minute, no need for suctioning or resuscitation, provide only routine care. If baby is gasping, start resuscitation immediately, and if baby is not breathing, on that time also start resuscitation immediately. While drying, assess baby's breathing. If breathing well or crying, then only give routine care, and if baby is not breathing well, on that time initial steps should be started. This is already discussed previously. This is the routine care I have already discussed is previously. Provide warm environment. Before that, I'll tell about the initial step again, that tie and cut the cord. Tell the mother that her baby is having difficulty beginning to breathe and that you are going to help him. Tell her quickly but calmly. Transfer the baby to a warm, clean, flat and dry surface. Provide warmth by overhead lamp or radiant warmer. Place the newborn under overhead lamp with 200-watt bulb placed placed around 50 to 60 centimeter above surface. You have to remember that overhead lamp with 200-watt bulb placed around 50 to 60 centimeter above surface, or place the newborn under radiant warmer. To prevent drafts of air, shut all windows and switch off fan before birth. Next, positioning the airway. Position the head by placing the baby on its back. Position the head so that it is slightly extended to open the airway. Place a folded piece of cloth under the baby's shoulder to help maintaining this position. The folded cloth should not be too thick or too thin. This may cause overextension or flexion, which will close the airway. Next, clear airway. Suction first the mouth and then the nose. Remember, M comes before N as described earlier. Then, tactile stimulation. If the baby does not cry after birth, wipe dry, remove wet cloth, position the baby and clear airway, then stimulate the baby for breathing. Safe and appropriate methods of providing tactile stimulation include slapping or flicking the soles of the feet, gently rubbing the newborn's back or extremities. Don't stimulate it by slapping the back, squeezing the rib cage, forcing thighs into abdomen, dilating anal sphincter, hot and cold compression or baths, shaking. After tactile stimulation, reposition the baby and assess breathing. Assess breathing. If breathing well, regular breathing 40 to 60 breaths per minute, or crying, and not breathing well if baby is gasping or not breathing at all. If breathing well, observational care should be given, that is, provide warmth, observe breathing and temperature, watch for complication, convulsion, coma, poor feeding, lethargy, respiratory distress, etc., and initiate breastfeeding if well. If not breathing well, ventilate the baby. If the baby is not breathing well, then immediately ventilate the baby with bag and mask. This is the flow diagram for basic neonatal resuscitation. The next part, neonatal resuscitation part 2, that is positive pressure ventilation with bag and mask, will be discussed later. Thank you.